Hello, Miss Washington. My name is Debbie, and I'm going to be your nurse today. And I'm going to be asking you a couple of questions about your health. And I'm also going to be doing a physical assessment on you today. But before we get started, I'm going to need you to let my instructor know that you are over 18 and you are consenting to this video.
Yes, I am over 18 and I consent to this video.
Okay. So the first thing we're going to start off doing is I'm going to ask her a couple of questions about her health. Have you had any chest pain?
No.
You haven't had any chest pain. Have you had any shortness of breath?
No.
Do you have any trouble breathing when you're lying down at night?
No.
What about fatigue? Do you find yourself getting tired real easy? Like maybe if you just walking or maybe even just climbing the stairs, do you find yourself getting real tired real easy?
No.
Are you able to keep up with your friends when you're out and about?
Yes.
Okay. Do you have any edema in your feet? I don't see any edema in your feet. Do you have any edema in your hands? You don't. Okay. So that's good. So what we're doing in this video, we're looking at the heart and the neck vessels. So we're going to start with the carotid pulse. And I'm going to palpate each carotid artery. And I'm going to make sure that when I'm palpating, I don't put too much pressure on the artery. So we're going to start here. And then I'll move over here and we'll palpate this one. And I do notice that they are equal on both sides. Okay, so the next thing I'm going to do is I'm going to look at her jugular venous pulse, but I'm going to have her lie down for this. I'm going to put her at a 45-degree angle. And so I'm going to be to the right of the patient. And I'm just going to get her comfortable, have maybe a 45-degree angle. And I'm going to have her ask her to turn her head to the left. And I'm just going to use a pen light, and I'm just going to look at the area, the pulsation. And I do see the pulsation. And I don't see any distended neck veins or anything. And the next thing I'm going to do is I'm going to attempt to measure the central venous pressure. I'm going to use this ruler, and I'm going to use this tongue blade. I'm going to place this ruler right at her sternum. And I'm going to use this tongue blade to put it at the level of the pulsation and measure. I'm going to place it on the sternal area here. And hers looks to be 2 centimeters, which is where it's supposed to be. Okay, and you can sit up now. Okay, the next thing we're going to do is we're going to auscultate her heart sounds. And I'm going to be using the Z pattern method. I'm going to come down to feel for the second intercostal space on her right side. And I'm going to be in the inspect the atrial area first with the flat part of the scope. Then I'm going to come directly across to the second intercostal space. And I'm going to listen in the pulmonic area. Okay. And then I'm going to be making like a Z pattern. I'm going to come down to I'm going to go along the sternum. And I'm going to come down to the tricuspid area and listen. And then I'm going to move midclavicular in the midclavicular area and listen to the mitral area. And then I'm going to come back and do the same pattern, same Z pattern with the bell of the stethoscope. Okay, I don't hear any murmurs or anything like that going on. And while I have her sitting up, I'm going to listen also to the base of her heart, which is the top of her heart. Okay, I'm going to have her lie down on her left side. I'm going to listen to the bottom of her heart, which is the apex. Lie straight. Lay on your left side. When you get your lay on your left side, come back towards me.